Welcome to today's webinar about grassroots advocacy, engaging lawmakers to advance legislation, featuring Megan Gordon-Dunn. My name's Jennifer Roeder. I'm a communications consultant for APFED, and I'll be moderating today's webinar. We're pleased to have Megan Gordon-Dunn join us today to share information about advocacy. Megan has extensive experience in developing grassroots advocacy programs and legislative campaigns for nonprofit patient organizations. She founded MGD Strategies LLC to develop high-impact advocacy initiatives to help clients reach their public policy goals. Plus, for more than a decade, she was the head of the Pancreatic Cancer Action Network's, also known as PanCAN, Government Affairs and Advocacy Office. Welcome, Megan.
Thank you. And thank you so much for having me here today. It is always exciting when individuals are interested in learning more about how they can get involved in engaging with our policymakers. And I know that that can be a somewhat scary concept to think I'm just someone who lives in San Antonio, Texas, and how can I engage my lawmakers? Aren't they big fancy people with super fancy degrees, and they don't want to really hear from me? And the reality is that members of Congress absolutely want to hear from you. In fact, they want to hear from you, their constituents, more than they want to hear from the lobbyists or the companies who work in their districts or states. They want to hear from real people. And that is regardless of what political party they are in, that is regardless of whether or not they are a US representative or a US senator. They want to know what their constituents care about so that they can make sure that they are representing their constituents adequately. So I'm going to share my screen, so bear with me for a second.
Absolutely.
So let's start by defining what advocacy actually is. So there are actually a couple of different advocacies and a couple of different ways that we use the word. So there's the kind of advocacy that all of you do on a daily basis, where you're advocating on behalf of your care as a patient, perhaps, with your physician, or maybe you're advocating with your child's school that they need to retake a test or need a different teacher. That's all advocacy, and we call that advocacy with a little a. Advocacy with a big A is when you go talk to a member of Congress and you ask them to take action on a specific issue. And again, this is advocacy with a big A is something that is available to all of us as citizens of the United States. It is our constitutional right to be able to talk to members of Congress about what we care about. So advocacy is really the grease that leads to action. Members of Congress represent huge states or little states or a congressional district that usually has about 700,000 people in it. So if you think of it that way, there are so many people with so many issues that they care about. Members of Congress don't know what are the things that their constituents care about unless somebody comes to them and talks to them. And that is really the foundation of our system, our congressional system, is that you have to make the ask to your elected officials about the things that you care about. And when they hear from enough people about a specific issue, then that's how they know that that's an issue that is really something that they need to pay attention to. So some of you may remember this little ditty from when you were growing up, or maybe you've watched it with your children, but it's a good refresher on how our system works.
Woo, you sure gotta climb a lot of steps to get to this Capitol building here in Washington. Well, I wonder who that sad little scrap of paper is.
I'm just a bill, yes, I'm only a bill, and I'm sitting here on Capitol Hill Well, it's a long, long journey to the capital city. It's a long, long wait while I'm sitting in committee. But I know I'll be a law someday. At least I hope and pray that I will. But today I am still just a bill.
Gee, Bill, you certainly have a lot of patience and courage.
Well, I got this far. When I started, I wasn't even a bill. I was just an idea. Some folks back home decided they wanted a law passed, so they called their local congressman, and he said, "You're right, there ought to be a law." Then he sat down and wrote me out and introduced me to Congress, and I became a bill. And I'll remain a bill until they decide to make me a law. I'm just a bill. Yes, I'm only a bill. And I got as far as Capitol Hill. Well, now I'm stuck in committee, and I'll sit here and wait while a few key congressmen discuss and debate whether they should let me be a law. I hope and pray that they will. But today I am still just a bill.
Listen to those congressmen arguing. Is all that discussion and debate about you?
Yeah, I'm one of the lucky ones. Most bills never even get this far. I hope they decide to report on me favorably, otherwise I may die.
Die?
Yeah, die in committee. Oh, but it looks like I'm gonna live. Now I go to the House of Representatives and they vote on me.
If they vote yes, what happens?
Then I go to the Senate and the whole thing starts all over again.
Oh, no.
Oh, yes. I'm just a bill. Yes, I'm only a bill. And if they vote for me on Capitol Hill, well, then I'm off to the White House where I'll wait in a line with a lot of other bills for the president to sign. And if he signs me, then I'll be a law. I hope and pray that he will. But today I am still just a bill.
You mean even if the whole Congress says you should be a law, the president can still say no?
Yes, that's called a veto. If the president vetoes me, I have to go back to Congress and they vote on me again, and by that time you're so
By
old.
that time, it's very unlikely that you become a law. It's not easy to become a law, is it?
No, but how I hope and pray that I will. But today I am still just a bill.
He signed your bill. Now you're a law.
Oh, yes.
So one of the things that you saw in that is really it starts with grassroots advocacy. And grassroots advocacy, telling those members of Congress what you care about, is the grease that gets things done. And so let's talk a little bit about rules and principles for how you can be an effective advocate. So first, you want to have a really clear understanding of what you're trying to accomplish. So you want to be focused and you want to have a specific goal. So for something like the EOE community, focusing on how you get the treatments that the patients in this community need and what's the specific problem that you want to address. So we're going to talk a little bit about access to medically necessary nutrition a little later in this. And so that is a specific goal, and we have a specific ask in mind that we want members of Congress to do. So you want to understand your audience. So again, members of Congress hear and have lots of constituents. And so they're balancing a lot of different priorities. And so you need to think through exactly how you want to communicate your ask and stay focused on that and ask them for something very specific so that there is a yes or a no answer on what you've asked them to do. As we've been talking about, Congress really cares that you're a constituent. So you want to pinpoint your geography and make sure that they know that you're a constituent. So you want to talk specifically about where you're from. And sometimes you want to even say, you know, hey, I not only live in San Antonio, Texas, but I live down the street from the HEB on Wurzbach, so that they know exactly they can place you in their congressional district. It is really important that you have a very concise message when you're talking to Congress. So you want to keep it very simple. So the KISS philosophy that we always talk about, which we usually say, keep it simple, stupid. We've changed it to keep it stupid, simple, because you really want something that is very focused and that is easy for a member of Congress and or their staff to understand. You need to stay on message. So a lot of times, and I'm a former health staffer, and I've been doing this work for a long, long time. And you would be amazed how many people get a meeting with their member of Congress or that member's staff, and then spend some time talking about what they really came in the meeting for, but spend a lot of time talking about other things like, yeah, there's a stop sign at the end of my block that got torn down by a construction truck, and we've been trying to get that fixed. And, you know, members of Congress want to make you happy. So they will look for things that you're talking about that will make you happy, but it's not necessarily the thing that you came in there for. So you want to stay on message so that they hear you asking about one thing and they're focused on that one thing. You don't want to use jargon. So, and this is for any medical professionals who are in the audience. This is specifically for you, but also really for anyone who's dealing with a complicated disease like EOE. It is easy to fall on the jargon that we all use as part of our daily lives because we're confronting these situations on a daily basis and in and out and talking to people who are in the same world as us. But remember, when you're talking to a member of Congress, they don't know the world that you know. And so part of your job is to explain it to them. So you want to think about maybe a 12-year-old smart child sitting in front of you and trying to explain what is happening and what you're asking about in terms that that 12-year-old smart child can understand. And by that, I mean that members of Congress and their staff are not stupid, by and large. Most of the people who work there are pretty intelligent, and you just need to find a way to connect with them. And so not using jargon and making sure you're explaining what you're asking about in simple terms helps them connect with you and understand what it is you want them to do. So you want to make what you're asking personal. And particularly as patients or providers, use your story to show why they should care about it. So your story is one of the most powerful tools that you as an advocate have. It is your personal story. You know it better than anybody else. And when you connect that to the thing that you're asking Congress to do, then it shows them in no uncertain terms how valuable their participation is and their action is and what difference that would make to your life. So you're the expert on your experience and in your field. You know your story and you're a constituent. And those two things are the ace up your sleeve that really makes a difference when you're talking to members of Congress. Now, the final thing, and one of my personal favorites, is that follow-up is the chariot of genius. You can have a meeting with a member of Congress or send them an email or interact with them in all kinds of different ways. But if you don't follow up, it's like that thing never happened. It's kind of like the tree that falls in the forest with no one to hear. You have to follow up. Again, think about all of the people that your members of Congress are responsible for. And think about all of the issues that they hear about. The issues that get done are the issues that they hear about more than once and that they keep hearing about it. So don't be afraid to keep on reaching out to your members of Congress on a specific issue. And even if they've responded on something, unless they said, no, stop talking to me about this, you keep going. And you keep going and you keep working to a yes until you get a no. So let's talk a little bit about how we put all those principles into practice. So all of you on this call today are familiar with EOE. These stories are stories that have been published on our website, the Patients, Providers for Medical Nutrition Equity Coalition, which APFED is a member of that coalition. And we have a specific place on the website where we ask people to submit their stories. And so these are some of the EOE stories that have been submitted. And you see all of them are talking about, or what if you could click on them, all of them are talking about people who are diagnosed with EOE and trying to get access to formulas. And those formulas, their families are having trouble accessing them because they're often not covered by health insurance. So APFED and the Patients, Providers for Medical Nutrition Equity Coalition have partnered together to develop legislation called the Medical Nutrition Equity Act. And that bill ensures coverage for children and adults through all insurance for medically necessary foods, vitamins, amino acids, and the equipment and supplies necessary to administer those foods. So we are asking everyone in this community and everyone in the PPMNE community to help us get the message to Congress that we need to support and pass the Medical Nutrition Equity Act, that bill that I just talked about. And we need all of that attention right now, because this is the end of this term of Congress. So in December, this term of Congress is going to end. And if we don't get this bill passed this year in 2022, we are going to have to start all over again in 2023. And we do not want that. We have put a lot of work into this bill and have gotten some phenomenal support in Congress for it. It has great bipartisan support in both the House and the Senate. And so we need every single voice that we can get to come together now to help us get this message to Congress that this bill has to pass this year. We're counting on that. So I'm sure I don't have to tell this community about the formula shortage and how that is getting so much attention right now, so much media attention. And the only positive side to this formula shortage that I can see is that it is really shining a bright light on these specialty formulas that our patient populations need and how vital those formulas are to the health and well-being of the people that rely on them. So we are working hard as the coalition to show Congress not only that the formula shortage needs to be addressed, but also that those same formulas, people are continuing to have access issues getting those formulas. And if we don't address those access issues, then it continues to put these formulas in jeopardy for patients way beyond when the formula shortage gets addressed. So the website for the coalition is nutritionequity.org. And I really encourage everyone to go check it out, because when you're one voice, you can't have a lot of impact. But when you join a coalition of hundreds, thousands of other people across the country using the exact same message and adding their voice to the choir, we can get things done. So I want to spend some time walking everyone through the options that we have on the website for ways people can get involved. So first of all, this is what our website looks like when you get to it. And if you click on the Get Involved, you'll see a couple of options. If you stay on the Get Involved link, you see this page that has a number of different options for you to look at. If you click on the first one, it's talking about, and let's go back and look at it. So the one that says use Twitter to help us spread the word about the importance of covering medically necessary nutrition in addition to dealing with the formula crisis. And if you click on this or click on this icon over here, you'll be taken to the same place. So you're taken to the next page that explains the connection between this formula shortage and the need to pass the Medical Nutrition Equity Act, or MNEA. So if you go to this page, you'll see there's some text explaining it. There's information at the bottom for how you can sign up for a Twitter account. And I know that people have concerns sometimes about using Twitter, but Twitter is really the best avenue for what we need to do right now, because it's the most direct and effective way to get our message to members of Congress. So I strongly encourage you to sign up for a Twitter account if you don't have one. And if you do, we've made it really easy for people to follow in this campaign. So first, if you scroll down in the page, you'll see step 1. And you put in your state and click submit. And then it takes you to step 2. And step 2 is we're asking people to send tweets to our congressional champions. So they know, they're able to say that we've had hundreds or thousands of tweets from people across the country who want us to pass this bill. So if you just click on the text here, you'll be taken directly into Twitter with the message pre-populated. So all you have to do is click tweet and it's done. And then you go back to the webpage, the nutritionequity.org webpage, and you go to step 3. And step 3 is to send messages to key congressional decision makers. So these are the chairman and ranking member of the key committees who decide whether or not to move the bill. Again, if you think back to the I'm Just a Bill video when they were in committee, these are the people who make the decisions to bring the bills to the committee. So same thing, you click on these and I'll take you in Twitter and you click tweet and that's it. Then you come back to this webpage and then it'll take you to step 4, which is contact your legislators. So everyone has 2 senators and 1 representative. And the way the system works is you have your messages for your 2 senators here, but then it's populating for all of the representatives in your state. So if you want to see who your representatives are, you can go back up to the Get Involved and there's a Find Your Representative tab and you plug in your zip code and it'll tell you who your representative is. So then you can go back down to the representatives here. I picked Minnesota and just send the tweet to your representative or send it to all the representatives from your state. So then you go back to the Get Involved page after you've finished the Twitter alert. And then we have a whole bunch of other ways to get your message to your senators and your representatives. And I really encourage everyone to do all the tools that they can and to help spread the word, because we really need every single voice. And like I said, we need a constant drumbeat. So we just talked about Twitter, but then you can send a pre-written email to your senators and representatives. And again, you just click on it and you're taken to a system where you just put in your name and your address. It'll show you a pre-written message that you can customize. And then you just click OK and it's sent, done. You can share your medical food story, which is so important. We really use those stories in so many different ways, and they have been so helpful in dealing with this medical foods crisis, with the formula crisis, because we've been able to explain to legislators using those stories why these formulas are so critical to their constituents. So please, please, please share your medical food story. And there is a special place on here that providers, once you click on this, you'll see a link just for providers, so you can share a provider story in addition to patients. You can just check to see if your senators or representatives are co-sponsoring the bill and just see what they're doing. So that's this link. Note though that our systems know whether or not your senators or representative have co-sponsored the bill. So if you click on the links to do Twitter or to send a pre-written email, it'll automatically generate the right response to your senators and representatives, either thanking them for supporting the bill already or asking them to do so. Oops. You can also like and follow nutritionequity.org or Patients and Providers for Medical Nutrition Equity on social media. And I really encourage you to do that so that you can see what's going on, you can keep active and share information with your followers as well. So we also have some tools if you've made requests and are looking to your U.S. senators and U.S. representative and are looking for other ways to get them engaged. And you can sign up over here to get action alerts from us. So when you see, we also have some questions about prior authorization. So this nutritionequity.org is really a great advocacy action place for anyone who is concerned about access to medically necessary formulas. And regardless of whether you're concerned about the formula shortage or access after the shortage, I encourage you to get involved through the website and really help us get attention on this issue and get the access that everyone in this community needs. So Jen, I think that's it for the formal presentation. Are there questions?
We do have a few questions. So the first one is, if I sign my name to a form letter to my congressperson, does that carry any weight, or do they ignore it because it's a form letter?
That is a great question. So let me give you two different ways that it counts. And this is coming from a former health staffer. So the first way, as I said, you can personalize those messages. And messages that are personalized, staff often will cut out the part that's personalized and put that in a separate document to share with the representative or senator to show them what is really going on with their constituents. So if you're sharing your personal story in those emails, then your senators and representatives will oftentimes see that. And again, that personalization, that sharing your story is so critical. The second way that those emails and the tweets really count, and this is why it's so important that people do them, even though they are form letters, is that there's a staff person dedicated in each congressional office who literally counts every message, every call they get on a specific issue. So I guarantee you right now, every congressional office has on their spreadsheet a line for formula shortage, for example, and they are counting every single communication they get on that issue, whether it's a form letter, a call, a tweet, regardless, and they're sharing that with the senators and representatives. So we need those totals to be as high as we can get them. So filling out those form letters really does make a difference.
That's really helpful to understand. Is it meeting with congressional staff versus their rep or the actual senator just as effective as meeting with the representative directly?
Yes. And in many cases, meeting with congressional staff is actually the most effective thing that you can do. Don't ever discount congressional staff. As I've mentioned, I mean, every representative has approximately 700,000 constituents that they are responsible for and countless issues. And so in their offices, they've broken up their staff by issue. So there is usually a healthcare staffer, and that person is responsible for telling the senator or representative what issues their constituents are caring about and making the recommendation to the senator or representative about what the member of Congress should do. So that staff person is a critical gatekeeper on telling, they write the memo to the senators and representatives saying, here's the issue of medically necessary nutrition. Here's why it matters to your constituents. Here's 2 stories that we heard from constituents. They want you to co-sponsor the Medical Nutrition Equity Act, and we recommend that you do so. And that's what we're going for. And often a senator or representative, if you meet with them directly, their response will be, let me talk to my staff about it. And then they go to the staff and say, so what is this issue? What should I be doing on it? So the staff is really an integral part of it.
Absolutely. Well, you gave some great resources about how to be able to contact representatives to share letters and emails. If someone is interested in having a meeting with them, how do you go about scheduling that?
Sure. So the best way is to just call the office and say that you are a constituent. And actually, I would say one of the best ways is to go to your district office. So you can look online, you look up, Senator Van Hollen from Maryland, and he will have on his website locations of offices. You find one of his district offices back in the state, you call the one that's closest to you, and you say, I'd like to meet with somebody about whatever issue it is that you want to meet with. And they will set you up, and it may take, a month, it may take longer. And you can ask for a meeting with the senator or representative directly, but oftentimes it'll be directed to staff, and that's okay. As we just talked about, that is 100% okay. So that's the best place to start in doing that, is really go through the district offices. And then as you build up a relationship with the district offices, then you can go, and if you're in DC, you can schedule a meeting with their DC office staff, which is usually the staff that is really the staff that I was talking about that focuses on those issues.
You've talked about when you meet with someone, the importance of keeping the conversation focused. If you find that the person that you're talking to isn't staying focused on what you're trying to talk about, do you have any recommendations for how to redirect the conversation?
I have a great story about that. So once upon a time, in one of my previous lives, when I was working for PanCan, we were meeting with a member of Congress, and we had brought a patient who actually had some notoriety at the time, and was literally dying from pancreatic cancer. And he was meeting with his representative, and we were, we knew what we were going to ask the representative to do. We had a clear goal, but the representative just wanted to talk about the university where this individual worked and his career field, because his son was interested in that career field. And so, he's asking all these questions about the university and how did the person we brought get into this field as a career, and what should his son do? And, and he was so clearly that's where his focus was. And so the person that we were meeting with, and this was a unique individual, pulled out a picture of his family on his phone, and he said to the representative, I would be happy to talk to you about these issues, but let me introduce you to my family. And this was in, I think, May, maybe. And he was like, this is my family. By Father's Day, they are likely going to be celebrating without me. And it was an awful, awful moment. And at the same time, there was nothing that the representative could say after that, except tell me more about your story. And so you don't have to be that dramatic. And certainly not everyone is comfortable with that kind of in your face. But we are, as patient and provider advocates, we are fighting for our lives. And so we need to be upfront about that. And there is no shame or harm or danger in telling a member of Congress, I understand that you are focused on this thing, but I'm here today because this is the thing that's important to me. And so we can talk about your thing after we've talked about my thing. And that's okay.
It is quite an impactful story. I mean, certainly, as you said, not everyone's story is going to be as dramatic, but everyone's story is just as personal and important to share. You talked about the importance of, when you're telling your story, being concise. Do you have specific recommendations on, like, if you're practicing what you're going to say, how many minutes should you bring it down to? Or if you're personalizing an email or a letter, don't make it longer than XYZ.
Right. So we always tell advocates that you should be prepared for a 15-minute meeting. Sometimes it'll be longer, sometimes it'll be shorter, but on average, that's what you should be prepared for. And that means you should have several different versions of your personal story. You should have the very short one. I'm Megan Gordon-Don, and I'm here today because I want to talk to you about EOE and the Medical Nutrition Equity Act. You can have a little bit longer. You know, this is my name. I'm from San Antonio, Texas. And I'm here because my mother is battling breast cancer, and I want to talk to you about her experience and this piece of legislation that I want to see passed. You can have, you know, a little bit longer where you're talking about the process that your family had to go through to get your diagnosis, or what you have to go through on a daily basis with the nutritional needs. So I would say you want your 1-second version, you want your 30-second version, a 1-minute, and maybe a 2-minute version. And you just, depending on what the meeting feels like, you maybe start with your super quick one, and see if there's time for your longer one, or you weave in parts of your longer one along the way. But you just have to have different versions of it that you feel comfortable with.
If someone has never contacted their representatives before, which of the various forms that you've shared do you recommend starting with?
So I think if you're meeting someone face-to-face, then you want to start with your name, your geography, and kind of maybe the 30-second version of why you're there. So you want to give them context for who you are and why you're asking about why the thing that you're about to talk about is your priority. When you're writing an email, you usually, I would say, want to include 2 to 3 sentences, maybe up to 5 or 6. If it's in a long form email where there's already a lot of text, you can also make your own. In many of these systems, you can delete a lot of the text and put it in longer if you want. Obviously, Twitter has a very small amount of text that you're able to enter. So that's kind of pre-selected for you. But I think it really, if you're meeting with someone in person, then it's getting a sense from body language. Is this an opportunity to expand, or is this, I just need to be quick and get to the point? When you're writing something, you want to give them enough. We often talk about hook, line, sinker. So you want to give them the hook. I'm here because I'm your constituent. This is the one sentence of why I'm here. The line, this is what I want you to do. And the sinker, is usually something about what you're going to do about follow-up.
Thank you so much for answering everyone's questions today. Is there anything you haven't had an opportunity to share that you'd like to?
I would just say that there isn't a single piece of legislation that has ever gotten passed that didn't happen without the support of constituents. So don't for 1 second underestimate the importance of grassroots advocacy, and find your place in it and find some way to contribute. Because this is if you're interested in medically necessary nutrition, we are at a unique and critical juncture with this bill, and this is our chance. This is the best chance we are ever going to have to pass this bill. So please get involved, and please go to nutritionequity.org and do any or all of the advocacy actions that we have listed. Get involved through APFED, and see what else you can do. And the other thing I would say is there are over 10,000 bills that are introduced in every Congress. Only 2% of those ever become law. And the 2% that do are the ones that people say need to get done.
Well, thank you again. If anyone here is interested in more information about current initiatives that are related to eosinophil-associated diseases, please go to apfed.org. And under the advocacy section, you'll find a page called Current Initiatives and Advocacy History. And we make sure to keep that page up to date with different things that we're asking people to help support. I'd also like to make sure we take time today to thank our education partners for their support for this webinar. We really appreciate the support of both Abbott and Bristol-Myers Squibb for this webinar series. Our next webinar is scheduled for May 26th with Dr. Carla Davis. She'll be joining us from Baylor College of Medicine in Texas Children's Hospital to discuss the chronic nature of eosinophilic gastrointestinal disorders. We hope you'll join us. To continue learning more about eosinophil-associated diseases, we also encourage you to subscribe and listen to our podcast, Real Talk Eosinophilic Diseases. In the latest episode, our co-hosts had a wonderful discussion about growing up with EGIDS with Kayla Abramowitz. She has a really interesting story, and we think you'll learn a lot from it. You can find the episode at apfed.org/podcast, as well as on Apple Podcasts, Spotify, Audible, and more. Just search for Real Talk Eosinophilic Diseases wherever you listen to podcasts. If you're interested in continuing the discussion that was started today, we hope you'll join the online network on the Inspire Network. It's a great place to connect with patients and caregivers for support. There's different discussion channels for different subsets of eosinophil-associated diseases, and it's a great way to really connect with people, hence the name. So check it out at apfed.org/connections. So thank you again for joining us today for APFED's EOS Support Webinar Series, and thank you, Megan, for a wonderful presentation. I hope everyone has a great day.
Thank you.